Hi, I'm Jackie Pack, a licensed clinical social worker with 28 years of experience. I'm also a CSAT, or a certified sex addiction therapist, and I own a therapy group practice specializing in treating sex addiction and betrayal trauma. In this video, I want to talk about setting a foundation for success in sexual addiction recovery. And I'm going to break it down into 5 steps in order to build that foundation. And at the end of this video, I'm going to give you an extra tip to get started. Overcoming the challenge of sexual addiction can be daunting, but with the right tools, support, and mindset, it's entirely possible. In this video, I'll explore key strategies and essential steps for building a solid foundation in your recovery. Based on the research of Dr. Patrick Carnes, we know that if people struggling with sexual addiction do certain activities, they get well. If they did not do those activities, relapse was likely. Your success in recovery is linked in an essential way to what you do. As I always like to remind my clients, as they say in recovery, no one can do it for you, and you can't do it alone. By integrating these 5 foundational elements, you can create a solid foundation for successful recovery from sexual addiction. So let's dive into the 5 fundamental elements that can pave the way to your success in recovery. I get that sounds pretty simple, and for a lot of people, it does take some time. Most recovering addicts did not want to start the sobriety process. Instead, they were thrust into it. Maybe things got way too unmanageable. Maybe they had pressure from their spouse. The journey to recovery involves overwhelming challenges and painful realizations. Accepting that recovery is a long-term process and requires dedication is key in your successful journey in sexual addiction recovery. Now, as they say in Alcoholics Anonymous, it's a simple program, not an easy program. Long-term recovery is achieved when approached in a multidimensional way. Addiction is a complex issue, which you may not have realized that if you're watching this, but when you hear that, it probably rings true. For some people, they can achieve a certain time period in sobriety on their own, but it often doesn't last. This leads to our second element of building a solid foundation. Finding a professional who specializes in sexual addiction is crucial because they possess the specific expertise and understanding needed to address the unique aspects of this condition. They are trained to identify the underlying causes, provide appropriate therapeutic interventions, and offer tailored support strategies. Specialized professionals can also help you navigate the complexities of sexual addiction, which ensures a more effective and comprehensive recovery process. Developing a recovery plan is usually done with your therapist, but you get a lot of input. A clear and structured plan with achievable objectives makes your recovery less abstract. A recovery plan usually involves weekly individual therapy, and your therapist will also talk with you at some point about starting group therapy, which the research indicates is an essential part of recovery from addiction. Often a recovery plan includes joining a 12-step program. There's several of them out there that are focused on the sexual addictions, like SAA, Sex Addicts Anonymous, SLAA, Sex and Love Addiction Anonymous, SCA, Sexual Compulsives Anonymous, and SRA, Sexual Recovery Anonymous. Having a sponsor and a therapist on your recovery team is helpful. What is the difference, you might be wondering, between a support group, like the ones I just mentioned, and a therapy group? Support groups are peer-led, whereas licensed professionals facilitate group therapy. Building a community of supportive individuals on a similar path of recovery is crucial to your recovery process. Having a community helps with understanding your sexual addiction, helps to hold you accountable, and helps in understanding the underlying causes such as trauma, attachment disruptions, stress, and other emotional issues. Group work also goes a long way in practicing the relational skills you will learn in a safe environment and allowing you to develop connections. Human beings are much more comfortable keeping the status quo. Change is hard, change is uncomfortable, but recovery is not about staying comfortable. There will be challenges that come, and at times, the process may be harder than other times. There may even be times when you wonder why you're trying to change in the first place. It's essential that you stay committed to the recovery process despite these challenges. As we say, never make a permanent decision based on a temporary emotion. Regularly reassess and adjust your recovery plan as needed, and get support from the community that you've put in place. It's important to understand that recovery is a gradual process. Be patient with yourself, have compassion for yourself. Change is hard, like I said. But remember, you deserve a life that holds meaning for you. Celebrate the small victories and learn from setbacks without giving up. Reach out to the community you've built for support and to help remind you why you want this. Talk about it with your therapist. With this foundation, we can start to build a solid recovery plan that guides you towards healing and a healthier, more fulfilling life. And again, for those who watched this whole video, I want to offer one last tip. So often with my clients, I will start with an anchoring behavior. To keep a vessel in one place, anchors are used to combat wind and currents that want to move the vessel off course. So as you start out on your recovery journey, it's important to put in place anchoring behaviors that keep you rooted or keep you anchored in a recovery plan. Now, this can be really simple. Sometimes I start, I'll ask clients, what's one thing that you can start doing every day? Sometimes this includes making your bed. I've had clients who it includes eating breakfast. Maybe it includes some meditation. Maybe it includes every day doing work on recovery. So it has to be one thing, and usually we start small so that you can set yourself up for success. And once you have that down pat, once there's some mastery over that, we add another behavior. And that chain of events or chain of behaviors starts to anchor you further and deeper into your own recovery process.